I like how working here every day, it really reminds me of why I want to be a doctor in the first place. You see all these patients with these psychosocial factors that are often unaddressed that prevent them from getting healthcare, and just being able to see them, these patients who have trouble navigating the healthcare system, it's extremely fulfilling. As a resident, it's easy to get caught up in the numbers, but you realize none of that really matters if you're not able to take care of these psychosocial factors in the first place. It's just extremely fulfilling just being the first one to help take care of these chronic conditions who have been not really well managed all these years in the past.
Well, one of my favorite things that I love at Mid-Valley Clinic are the patients. They're just super genuine. We have a great diversity of patients here that we get to see, and I'm just lucky to be here to help them.
I think it's an opportunity to see a different patient population. It's an opportunity to be of service. Anywhere that you are in the U.S., there is going to be a county system, and patients are going to need to go be seen there. So to understand how it works, how the system works, what kind of patients are seen there, and just the administrative running is very helpful. And we really do a good job in the clinic of seeing these patients and giving them top-notch care.
My favorite thing about working at Mid-Valley is working with the patient population that we work with here. The patients here are, by and large, so grateful for the care that they're getting, and it really brings an extra level of satisfaction to what we're doing on a day-to-day basis, which sometimes we don't realize how important the work we are doing is.
I really feel like we are very much a cornerstone part of this community. I also really enjoy the diversity here in the San Fernando Valley. I've had patients who speak Russian, Armenian. We have a large Spanish-speaking population here at the clinic, and I've even had Chinese-speaking patients as well. I have to consider a very differential diagnosis based on the country of someone's birth, where they travel to frequently, often unknown immunization status. We see a lot of advanced pathology for chronic disease that maybe we wouldn't have seen if patients had more regular access to healthcare as well.
It's embedded in the LA County DHS, Department of Health Services, second largest safety net in the country, but it's a patient-centered medical home certified by NCQA. And so what that means is that we get to work with care managers, RN caregivers, and we get to work with community health workers, and we have a multidisciplinary approach to our, to care for our patients.
Mid-Valley is where you'll spend at least half of your clinical training at. It is a county clinic. We are also a PCMH. The patients are incredibly wonderful and grateful for the care that you provide. And it being a county setting, it allows you to practice navigating how to provide the best care for patients in a limited resource setting. If you want to do underserved care in your future, then you should have practice achieving that level of equity of care for your patients.
You see patients who have gone through so much, they're trying to get care that they need, and a lot of times they've had a lot of trouble getting to the right doctors or getting to the right places that they need to be. And you're able to get them connected with the resources that they need. It's really rewarding for yourself, and you feel great for the patient as well.
I love to precept the residents. They just have a great energy and enthusiasm and excitement for patient care. They're incredibly dedicated to these patients. These are some of the most caring residents I've met, and it's just a joy and a pleasure to work with them.
They're super cool and very understandable. Teamwork.
Yeah, it shows teamwork. One of us isn't as smart as all of us together.
I just like that we have new blood. We need young people to take care of us old people.
For me, I see the dedication, how dedicated they are to work here and to serve the population, underserved population. I just appreciate their hard work and willing to work with the staff. By the time they leave here, it's always like a family. We miss them when they leave. So it's just something that I really appreciate, working with the residents.